Hi, everyone, and welcome back to Becca Babbles podcast. I'm your host, Becca, and today I haven't done a personal episode in a long time. Today I am doing a podcast all about Tri-6. I can't believe Tri-6 is done. It kind of freaks me out being like, oh my goodness, I'm more than halfway done. I started this try, and it was so heavily focused on boards that I almost forgot that, I'm almost done. Which is crazy to think about, and I'll get more into it in my personal episode, but because this podcast is basically gonna mostly be about specific classes and, tips for classes and, how the classes are structured and the breakdown of all the things, all the stuff that everyone wants to know, and then the second part is gonna be my, reflection and answering your guys' questions. But I'm gonna tell you, this podcast is gonna make me seem like a completely different person compared to the last podcast because I remember Try Five recording that podcast and being like, guys, that one was hard for me. That one was rough just for personal stuff that's been going on in my life. But also just the workload for me, lots of changes in my life, and then the frustration of just being like, I'm not doing what I want to do. And then you hit try 6, or at least for me, and I was like, this is probably my favorite try so far. And I think it's just because you're actually applying what you're learning. It's the more you go through it, it's less and less of the book stuff, which is so freeing. But I also want to keep in mind, because I know a lot of people get really angry about why didn't we do this at the beginning? Why do we have to do all this book work and stuff? We're chiropractors. And it's we were having a conversation with one of our professors. You guys probably know her already because she's big within the Parker system. And that is Dr. Marianne DMAC, also known as SheMac. And she was talking to us about how we were going over a podcast in one of her classes, and someone had brought up the reasoning of why didn't we learn this in gross? Why didn't we learn about the fascia in gross? Why didn't we learn about, it was something else that I can't remember right now, but she was like, think back to your try 2 self. Think back to your try 3 self. Do you think your try 2 or try 3 self could handle the complexity of all of that? And I was like, okay, fair point. So you have to earn your respect to the knowledge that you are given, but that doesn't mean you still can't mess around and look into stuff. That's why going to outside seminars are important. That's why talking to professors about things that you have questions about or doing your own research. Why I made my own podcast, cuz this helps me dig into more things and then also be able to educate you guys. So I will say that, but I also will say this one is definitely my favorite try so far. And along with that, I think I finally kind of, maybe, I don't know, maybe just the tiredness of myself allowed me to do this, but I finally let go of getting those perfect grades and just focused on learning. And I feel like there's two different perspectives you can go at this. When people say, "Oh, I just let go of the perfect grades or needing the perfect grades," everyone thinks "Oh, you just gave up and you're just saying, "Oh, just get C's make chiropractors or D's get degrees." And I'm not saying that, because I am the furthest person from believing that you should just strive for the lowest expectation or that you need. What I am saying here is, don't let the grade dictate your learning. If you go into a test and are like, I know this stuff, I could tell you this, I actually understand what is happening, or I have a grasp of the concept, but yet you make a B or C on a test, I don't care. As long as I know and it's actually helping me move forward, because life isn't going to be a test. Life is going to be an actual human who is in front of you that isn't a textbook. So I finally was able to just let go of needing to have those perfect grades and focus on like, I just want to like sit down here and learn. It's really funny because we go through chiropractic school and needing to like get the grades and learn and all this stuff. And then we leave chiropractic school and we had all these professors around us to ask all the questions in the world, but we didn't because we weren't sure if the question made sense or we were afraid our professor thought we were stupid. And then we go to all these seminars when we're older for fun and or just to get your CEUs, but I would hope it's to like actually learn and expand on the knowledge that you already have. When like why can't we have that mindset when we're in school? Yes, get the grades, yes, pass boards. But like if I would have came at school sooner with the mindset of let go of the perfect grade and like actually learn what's in front of you, and don't worry so much about getting that A, I think I'd have a lot more fun. And I wouldn't have had the dramatic moment of try 5 for myself. So, that's just food for thought for the beginning of this podcast. Like I said, I'm going to break down the different classes I had in try 6. I'll talk about the instructor, the structure of the class, my favorite moments and what I had learned, anything that is like aha moments, I guess you could say, study tips, lab tips, and any sort of like funny moments that I think apply to the classes. In Try 6, if you're taking the full course load, you are taking 8 classes and you are able to apply for a master's program if I think your GPA is a 3.0. Um, I'm not for sure on that. Also, you have to make sure that you have your bachelor's. So this girly officially has her bachelor's. If you have been with me for a while, you know that like I started in the pre-DC program. So I went to community college first, and then I thought I was going to be pre-PT, go to UNT, do pre-PT. And then I decided to like flip that on its head and go, hey guys, I'm not going to be a physical therapist anymore. I'm going to be a chiropractor. And I went through the pre-DC program when I was doing that. And for anyone who is doing the pre-DC program right now, which this kind of sucks that I'm saying this now and not like try one or in the pre-DC podcast. I hope I said this in the pre-DC podcast, but if you have not gotten your bachelor's or your like bachelor's in science of some sort, make sure when you're talking to your advisor that you look at the specific classes you need for the master's program or to get that bachelor. So like for instance, I had a friend who he had enough credits to get into school and he was just doing the pre-DC program to get into chiropractic school because you just need like 90 hours. And he was just taking the classes that he needed and he was like, I don't want to take physics. I don't want to take physics. I don't want to touch it. And I was like, okay, fair. Because I was the same way. And then now he has to still take that class to finish his bachelor's, to then take the master's. So what I did in the pre-DC program is like printed out that piece of paper and was like, I literally went up to my advisor and was like, I'm taking this class and I'm taking this class. I don't care if like this increases my course load. It's just I'd rather get it out now than when I'm in chiropractic school. If you want more information on the pre-DC program, go to my pre-DC podcast. But again, I kind of feel bad that this is in the Try 6 podcast and not in like Try 2 or pre-DC. I'm just going to hope and pray that it was in the pre-DC podcast. But anyways, so once you have that bachelor's, then you're able to take a master's. Right now, I am starting my clinical nutrition master's program, and I've enjoyed it so far. I've only had I don't know if it goes by trimester. It does the like subterm thing that I explained in the pre-DC podcast where like for 7.5 weeks you do a subterm and then for 7.5 weeks you do the like B subterm and then it like starts all over again. So I've only taken like 2, I guess I would be considered classes. So it was like nutrition therapy 1, nutrition therapy 2, And if you guys want me to break that down more, if you're interested in me doing a podcast about that, let me know in the comments, either on YouTube or on Spotify. There's like now a little comment section that I've now realized was a thing. So I might start messing around with that more with the polls, but we'll just see with the amount of time I have on my hands. So yeah, just let me know. Or you can DM me on Instagram. Probably that will probably be the easiest thing if you DM me on Instagram at Becca Ann Wellness. So, anyways, let's get into these classes. So, the first class that I want to talk about is Functional Assessment Protocol, also known as FAP. Like I said, this one is by Dr. DMAC, also known as SheMac. And you will realize this in a second because if you don't already know, there are two DMACs at Parker, and they're both in the same trimester. So, that doesn't make it confusing whatsoever. Um, the class is basically set up where there is a 1 hour in-person lecture and there is a 2 hour in-person lab. What you'll learn in this class is all of the movement assessments. So think about how in ortho you learned like different tests to tell you like to rule in or rule out a pathology or some sort of diagnosis. This is kind of like that, but it's not as specific. And even Shemak was telling us that she wants to take the word protocol away and put principle because she's like, I don't go by protocols, I go by principles. And it's fair because if you think about this class, you're just observing how someone moves and then you're making hypotheses or hypothesize. I'm not good with plurals and non-plurals, but you're just making guesses on what you think might be happening because that's what happens in like real life where you're just like, okay, I have seen someone have these same sort of symptoms and I want to see how you move and I think this intervention is going to work. So this is the class where you really start thinking clinically in this class, or critically in this class, so that when you get to clinic, you can see how someone moves and how that might be affecting the pain that they're dealing with. If you ever heard of SFMA, also known as Selective Functional Movement Assessment, I don't know if it's the same movements or she took like her favorite ones from the book. I just know I want to read it. There's like a ton of seminars on it that you can take, but I've also heard that like reading the book gives you a good foundation and like I'm always here to expand my learning. I will say her teaching style is very different from your other professors. So if you haven't gone to any like seminars before, this might not make much sense. And once you get into the class, you'll be like, that makes sense. My way of describing her teaching style is like seminar style teaching, and I loved this. Like it literally felt like I was going to a seminar. She was always hyped. I'm pretty sure she would say like she hasn't even drank a cup of coffee and she's like ready to go and she's hyped because she's excited to teach um she's excited to teach what she has planned for you guys. She likes to go down a ton of different rabbit holes and she'll use this term back to the farm very, very often. And I know some people would get frustrated with that because you want that like clear cut plan of like, what am I supposed to do for the test or what am I supposed to know? And I'll just say like her tests are easy if you pay attention. If you pay attention in lab, if you pay attention in lecture, they're really easy. She just wants you to learn, think critically, and I think my mindset of just being like, "Hey, I'm just here to learn and I'm not here to just get the grade," worked really well in my favor for this class because I wasn't so uptight about getting the perfect grade and worrying about like how am I supposed to study and all this stuff. You will have two practicals for this class. You'll have a midterm and a final. The midterm is pretty easy. So like in lab, you'll learn a couple of different assessments and you'll only learn like half of them by the time you get to your midterm, and you'll perform that assessment. You'll basically list out all the findings that you see. So I remember going in with my friend and we are like, okay, let's be one of the first ones because I hate being the last one. And like my anxiety starts to stir up when I am getting ready for a practical. And we went in there and you draw a card just like ortho, I was like, this is giving me PTSD from ortho. And you draw a card, and that's the assessment that you're going to do. And so you do the assessment, and then you look at your partner, and right as they're doing the assessment, I highly recommend just blurting out everything that you see. Blurt it all out, right and lefts, all the things, so then you don't have to think back, oh, what did they do? Even though I just saw what they did. Especially when you're in like a high stressed environment, I know it can be a lot to like remember things. So just blurt it out once you see it. And then basically you just say, okay, they pass or they fail. And then they'll ask you like a question afterwards. I know I had ankle dorsiflexion test, which you guys haven't learned that one yet, but obviously because you haven't taken the class. But I had a question where it was like, which muscle is like interfering with this test or something like that. So it's not too bad. It's like if you just it's just taking the assessment to another level to make you again like critically think or to test to see if you actually understand what is happening. So again, like I said, just pay attention in lab. The second practical though is a little bit different. I will say it was a lot on my brain to kind of handle all of this, but you'll have like 4 different stations. The first one is basically your first practical. You perform the assessment, you list all the findings that you see. Well, actually, I can't remember if you list all the findings or you list one of the findings. Check with your rubric. It's either you list all of them or you list one. And then you say if they pass or fail. Now, what a lot of people get nervous about is like if their partner passes, what they should do. And this, I'm going to say, like, you're learning with your eyes. You're strengthening a muscle in your eyes to like actually see movement patterns. And more than likely, someone is not going to pass. There's going to be something that's up. Maybe with like ankle dorsiflexion tests, they might pass pretty easily. But for the most part, like we're sedentary students and we've probably developed some compensations by trisix, even if you're like a healthy 20-year-old. um, there's going to be some sort of movement pattern that they're missing out on. But if they do pass, she has this format where like you can then pick a hypothetical, and I'm telling you right now, like don't pick the hardest one. Pick the easiest one that you like know to go with. Then you'll go to station 2, and this is basically you're like, let me chill out for a second, let me take a breather, and then I'm just going to try and like figure out, okay, what do I want to do next? Because basically what you're doing is you're picking a follow-up test because you can't say this is what's going on just based off of one test. Kind of like with ortho, where it's like we have all these tests that have a likelihood ratio that tells us, okay, if this is positive, this is the likelihood that we have this test, depending on like the studies saying their like likelihood of the test. Anyways, sorry I'm being very vague with that because I can't think of a test off the top of my head right now with the numbers. I'm not Dr. Moore. Um and you'll to rule in that actual pathology, you need to do more tests to like actually say like this is the issue. Same thing with FAP. You're not really picking a specific diagnosis or anything. You're just making it easier for you to create a hypothesis of like, okay, this is what intervention I'm going to do because I think this is going to like help with their issue. So that's where that station where you're like kind of thinking she'll give you a piece of paper and you can jot everything out. Most of the time I find that it's either like a mobility issue or motor control issue. And within this class, it was really cool because I actually was able to fully understand the difference between mobility and motor control. Because I see on Instagram all the time people being like, doing mobility exercises or doing my mobility routine. And I know I've even been one of those people who are like, I'm doing my mobility routine or whatnot. And actually knowing the difference. So like mobility, I almost think of it as like when you're palpating in your classes and you feel a restriction. that is a mobility. There's a restriction there. You're going to have an issue because there's like something is not moving well. To where motor control is more like your brain's connection to the joints and the surrounding muscles. So for a motor control issue, your active range of motion is going to be less than your passive range of motion. So let's say I was stretching my hamstrings, for instance, and I was able to bring my leg up to 90 degrees actively. And then someone comes up and is like, I bet you can go further. And they passively push my leg further. That means I have the range of motion to go further. I just don't have the connection from my brain to the muscles to actually go further. Or something is like well, that would be more of a mobility issue. Anyways, let's keep on track with the control that you have. So I don't have the connection to the muscles to like get me to that further range. I only have the connection to the 90 degrees. To where if it was a mobility issue, my passive and active range of motion would be the exact same. So even if someone came up and tried to push my leg further, they'd be like, your hammies are tight. Actually, I don't think that was a good example because I'm pretty sure Shemak would tell me that's wrong. Well, anyways, for this instance, for this example, let's just say that like some muscle was tight, and as someone's pushing it back, my muscles are so tight that like they can't push me any further. So then that's where you would go in and like do soft tissue work. So again, there is a difference, and it was actually really cool to understand the difference within that class. So sometimes I'm like, when I want to say I'm doing mobility exercises, I'm like, am I though? Am I? And then another thing that comes up a lot in this class is proximal stability for distal mobility, which basically just means like your core is important. And this is actually kind of funny because I used to be obsessed with the core when I was younger. If you guys know my story when I started this podcast, I talked about my eating disorder, and I talked about how I was like obsessed with getting a six pack. I was like, all I wanted was a six pack because I thought that somehow equaled performance or that I was a good athlete, which is now completely false, and I know that. And I was obsessed with getting this six pack. And then as I got more and more into health and fitness, I realized that like your core is more than your six pack, and that like just flexing doesn't make you strong. And so then I was like, oh my goodness, there's these things called like external obliques and internal obliques, and like your core is 360. So like let's train your core and get strong. Or like just because you're doing sit-ups doesn't mean your core is strong. And so I had that epiphany. And then go to chiropractic school, and I learned this before because I went to clubs like R2P and MPI. um, and I learned about intra-abdominal pressure. And that is where you are able to use your full diaphragm and take a full diaphragmatic breath, and your pelvic floor also contracts at the same time, and you can actually have this stable core foundation so that your shoulder can move in its maximal ranges. And this can also be a part of that motor control topic where you are, if you don't have that proximal stability, you won't be able to like show that distal mobility of like moving your arms, moving your legs. That's why DNS is a big topic that people are talking about in chiropractic school, or at least at Parker. And the best explanation that I can give for this, or like visualization, is like think of like a can. um let's go like Coca-Cola. So you got a Coca-Cola can. If the can has all of its pressure 360, like you haven't opened the can or anything, I could stand on that Coca-Cola can and it would like have this firm foundation. But if I opened that can up and like drank all the Coca-Cola or drained it out or whatever, and then I tried to stand on it, it would crush. Like, its pressure is gone, so it can't elicit its strength. Same thing with your core. So that's why it's so important to actually train your core or that your core is 360 and maintaining that pressure. So stop sucking in your belly button and like you can breathe out and let it hang out. And it's also made me have to rethink some of the ways that I train. So like we like did all these different assessments on each other. One of them was like supine breathing, and I remember Shemak coming up to me and being like, "See, Becca has that like V taper, and like the her rectus abdominis is basically like popping out." She was like, "She's got some strong um external obliques," and what I think is what was happening was when I got obsessed with doing more core training 360, I started doing a lot of like wood chop exercises and like oblique exercises, but I was always drawing my core in. I was never creating that pressure and bracing outwards. Like I would brace when I would do like deadlifts and stuff like that, but um a lot of the times I think I was still drawing in when I was squatting and deadlifting. I think when I was squatting I was drawing in or at least bearing down. Um but I wasn't like creating this actual brace. Maybe I just need to do a full podcast because I'm going way into depth when I don't need to be. Um and when I did the wood chops, I've noticed when I went back to them that I have this habit of still drawing it in. So I think that's where that V taper came in. So like now I just like have to reteach my body how to actually be more functional, which is fine. We always love learning. So anyway, so those are like the two big things that I find are like the biggest thing when it comes to that like station 2 or trying to like figure out what the issue may be. Because then you'll go to station 3 and actually tell them like, hey, this is the follow-up assessment I want to do and this is why I want to do it. And then station 4 is basically going to be like, why do you think you saw what you saw? And that could be like the motor control issue or proximal stability versus for distal mobility conversation. It's not always going to be that, but it tends to be that. Um, and then the last question is then like, what is your intervention? So like for example, there's a test called arm lift off test, and it could be a mobility issue because like let's say there's like a restriction in the shoulder joint and we need to do some sort of adjustment so that we can actually get that range of motion. Or it could be a motor control issue with the rib cage causing then decreased range of motion in the shoulder, because if you don't have control over your rib cage, then that's that like proximal stability for distal mobility. But like if you don't have that control over the rib cage, then that is then going to affect how the shoulder moves. It's that whole like your body is connected argument. And for your interventions, make sure you don't just put adjust. Make sure you put like in what direction and the like segment you're adjusting. Because if you just put adjust, you could be adjusting the T spine instead of like the shoulder. So make sure you say that. Or like it could also be like for that motor control issue, for the example that I gave, it could be a supine breathing progression. I kind of gave like a lot of tips for this class already, but I'll kind of narrow it down a little bit more. And that's honestly like pay attention in class. Pay attention in class. She literally says, I don't want you studying for this class. My goal is that we have all the conversations that we need. Obviously, you need to do some sort of reviewing because you can't retain everything. But I will say, I felt pretty confident after every class that I was like, okay, I think I understand this. Um, if you want to get more organized, and this is what helped me, was making some sort of table or make a piece of paper of the different exams and then writing down like what makes them pass, what makes them fail. And then when you go back to study for the practical, a lot of the times what happens is people are like, oh, if I get this specific test, let's just say like Yonda's abduction, then I am going to go to single leg squat. And it's like, well, but why? Why does like that exact test make you think that you need to go to that exact assessment. It's actually gonna be how that person presents is going to play into why you're doing that next assessment. So instead of saying, "Okay, because I got Yanda's abduction test, their legs started, like, rolling forward." So, like, maybe their, hip flexors are tight, because they can't stay in that extension position, then you're like, okay, well, I want to see what happens in Yonda's extension because maybe the hip flexors are keeping them from going into full extension, something like that. So, like, go through and look at like what makes the assessments pass or fail. And then if they fail like a certain requirement, then based off that, then go into this is the test that I'm going to do because I want to see XYZ. And I did that with my friends studying for the final practical, and it really helped. We literally went one by one with each one, and I felt pretty confident going into that test. But not gonna lie, when I got to that fourth station and I was reading the question, I was like, I don't think I understand English anymore. I was pretty sure my brain was pretty dead once we got to like final practicals, but it is what it is. My next tip is just be open-minded. I know a lot of people are like, we're in chiropractic school. Why do we need to know functional assessments or just basically whatever your point of view is when it comes to chiropractic school or your philosophy with that or why you came into here? And I feel like I'm just going to repeat this over and over again. Be open-minded because you never know how you're going to change in the future and maybe what you wish you would have understood in the class. And also just make school more enjoyable to be like, let me get curious about this. So that's my argument with that. And then also go to R2P. I feel like the hardest thing with this class is the verbiage, if anything. If you don't understand what a clinical audit is, if you don't understand what AIP is, if you don't know what DNS is, go to at least R2P club when they are talking about those things or have certain subjects on that. So then it makes it a little bit easier when you're having these conversations and you understand it a little bit more. Hi everyone. So this is currently editing Becca, and I realized I was using the term AIP instead of IAP. So just a heads up, when I say the term AIP, I'm meaning IAP for intra-abdominal pressure. Hope you enjoy the rest of the podcast. I think the people who have the most advantage when it comes to these classes are the people who went to MPI and R2P because they actually understand the words and the verbiage that's been going on, and they've heard these terms multiple times used in different ways, and it's not their first time seeing these words. I'm not saying you have to go to pass the class, but I'm saying it makes it a little bit easier, and that way you're also surrounded by people who understand these words a little bit more, and you can ask them questions so you get a better understanding of it. All right, that was a lot for the first class, and I have 7 more to go. I might have to take a break just to drink my water or my, like, 2 sips of tea I have left. All right, next class is Clinical Imaging 5. This is with Dr. Cates. I actually had her the full time this time. Last time I only had her for 4 weeks of Clinical Imaging 4, and she went on or she had her baby, and then she had maternity leave. So makes sense why she was gone. But I actually got to have her this time. And the class setup is kind of like your typical clinical imaging class setups where you have 2 hours of in-person lab, and then she'll have like an online lecture portion. And this is like asynchronous, you do it yourself, and they're typically about like 30 minutes to an hour. I don't think anything was longer than an hour, which is really nice because I have gotten sick and tired of watching podcasts. I'm not gonna lie. Um, and the rumors are true. This class is basically everything you learned from Try 2, it comes back. So those spondies that you hated and the lungs and the abdomen pictures where you're like, I don't know what's happening. And the cancer and the arthritis that you're just like, I'm not sure. It all comes back. I will say though, I learned that I actually learned so much throughout my school time in chiropractic school with clinical imaging. I was so scared of this class because if you guys have listened to any of my other chiropractic podcasts, I have not liked clinical imaging very much. It's not my favorite. It is probably always on the lower list of mine of like actually being something that I really enjoy. But I've realized that because I paid attention, because I persevered, this class wasn't as bad as I thought it was going to be. So, if you are listening to this ahead of time, just keep persevering in all your other clinical imaging classes and you'll be fine. She does do a lot of reviews, but I will say, don't just say, I did great on the review, so I'm going to do amazing on the test. Like, I remember the first exam she gave us was pretty brutal. The next couple of tests weren't too bad, but I think also you get a better understanding, obviously, of like what the test is going to be like. So I remember in that first exam being like, I know what the diagnosis is. Finally, I finally know what the picture is showing. But it wasn't like, what spondy is this? Or like, what lung pathology is this? It was you had to know the picture and then any characteristics of that disease with the picture. And I wish I had a specific question that I could give you guys, but I don't. The best thing that I could say is that understand the conditions and like anything that goes along with that. So if it's more common like females and males, kind of like with the whole like cancer thing where you kind of like had to figure out what cancer it was based off the text. You will have some tests that are only pictures. You will have some tests that are only text. I think two of them are only pictures and two of them are only text. Um, and you had one where it was like full just lung and abdomen. So make sure you know those for sure. But overall, I don't feel like the class was awful. Like some people make it seem it is. I think a lot of people just get intimidated by the clinical imaging classes and the fact that everything comes back. And if you take a breath and you realize that you have been paying attention in clinical imaging and you have been trying your best, you might actually shock yourself more. Like, of course, you're going to have to put an effort into the class, but as long as you continue to pay attention in the class, like, you'll be fine. Tips for this class is basically like review the study guides that she gives you, but like also any of the diseases that she specifically talks about in those reviews, go back and look and read about those diseases so you understand, or any of the signs that go along with that disease. There's a sign called the pooping duck that everyone like freaks out about, and I would just make sure you know that one. The other thing that I would say is like review your reviews from previous clinical imaging classes. I had a lot of information from when I did tutoring with Rick. His name is Rick. I did tutoring with him, and so I went back and I just remember studying for I think it was the cancer one, the abdomen one, and the lung one. Or at least I thought it was all the same test, and it turned out it was only abdomen and lung. And I just like jotted everything out. I just like brain dumped that thing like crazy and then looked back to see like what I didn't remember. And that was really helpful because I'm a very visual and physical person. So me visually seeing something, I could actually like write it all down. All right, the next class is your business class with Dr. Carbonelli. This class setup is basically an hour in-person lecture, and it kind of is what the class says. It's the business of chiropractic. So you start off with learning how to create a vision statement and a mission statement and your company values. She'll let you use ChatGPT to like generate ideas and to also see how when you use ChatGPT or AI in general, how generic things are and the words that you use in the questions will determine what comes out of ChatGPT and the responses you give. So sometimes you have to be a little bit more specific with that. So it's fun to mess around with that. You do talk about insurance. I will say that lecture like went over my head. I remember walking into that class and being like, I'm going to try as hard as possible to actually focus and understand this because I want to know if maybe I might actually take insurance if I actually figure this out. And it just went whew. So maybe that's another thing for another time. The next thing that you guys kind of talk about is like creating your own business. You'll actually be in class and you'll be filling out this like spreadsheet of like, okay, where do you want your business to be? What kind of business do we want to do? Where do we want it? And stuff like that. And I feel like the thought process that came into actually trying to that activity being a good thought in mind, but it almost seemed, like, unrealistic in the sense of, like, everyone was like, "I want new this, I want new that, I want new this," and it's like, when you get out of chiropractic school, you're in debt, and you wanna start a business from scratch, you're gonna start out with the bare minimum until you start making a profit, most likely. So, I just keep that in mind when you guys are, like, actually creating your own business and don't just think, like, Oprah is on the other end of chiropractic school and she's gonna give me all the things because that's sadly not what happens. I will say it did make me realize how much goes into a business because I don't have like, I have some family members that had started a business, but not in, like, the healthcare aspect before. So it was cool to see, like, what all goes into a business, and then you also get, like, really good spreadsheets for the future if you do wanna make your own business, and it already, like, creates all the calculations and stuff like that. So that was really nice. She also goes through talking about, like, interviewing questions and, like, what to look for in a boss. I haven't really thought about that before in the aspect of, like, thinking about what I should find within a boss. I have mostly just grown up of, like, "Hey, work hard, do the thing, and, like, get busy," and I never thought about, maybe I should be more specific with the kind of boss that I want, so that was, like, cool to have that conversation. And then also the talk of, like, you can ask for more, which was really nice to have. And then at the end of the try, she just, like, answers any questions that you had that you put in this, like, little forum that she'll give you guys. You will have weekly quizzes and a weekly assignment. For the most part, they're, like, pretty easy, and all of her tests are open book and open note. She's like, "I understand that you guys are not business majors, so you will have access to the internet when you are in business and you are able to use tools. I just ask that you just use your notes." So that was really nice to be like, okay, I don't have to be stressing about like, do I know everything along with business? So with that, the tips for this class is just like pay attention in class, ask the questions. Even if you don't want to run a business, it's good to know how a business should be run. So you realize the person that you're working for is like running their business the right way. And then also a way that like will keep you having a job, which is nice. I will also say, especially if you're someone who wants to run a business in the future, I made a document with like all the tips she just gave, referring to like business, buying a place, talking to an employer, connections, stuff like that. That way, when I leave chiropractic school, if I want to start my own business or if I work for someone for a long time and then realize, okay, now I want to start my own business, I can reflect back on that and be like, okay, what was some advice that I was given a long time ago? So then I don't have to go out looking for that again. So make a little like tips document, and I think that will be helpful for you in the future. All right. Next class is Physical Therapy 2, the active version. And this is with Dr. Cody DMAC, also known as HEMAC. Like I said, there are two DMACs at Parker, and you will have them both in Tri 6. And to be completely honest, when I first met Dr. HEMAC, he reminded me of my tennis coach. I remember specifically I was in what was it? Parker. It's like Parker Power Weekend, I think that's what it was called when I went. And I remember walking in and being like, "I'm so excited to go into this physical therapy class," especially because like, I wanted to go to PT school first, so that makes sense. And I walk in, and I was with my mom at the time, and he was wearing the Vivo barefoot shoes, and like he just had the mentality. Like some people call him a gorilla, or I think he calls himself that, to be honest. And my tennis coach was like, he was in the Marines and he decided to become a tennis coach and he was like super into kettlebells and stuff like that. And I was like, I know this man because I've been trained by a man like this before. So it was really funny. Um and so I've always gotten that vibe. And then my mom looked over at me in that moment and was like, yeah, I know you're gonna wanna go here now. So that was just a flashback from the past. But this class setup is 2 hours of in-person lecture, and then you have a 1-hour online lecture that you just watch asynchronously. And I'll say, please watch these. Like, I know a lot of people don't wanna watch vodcasts anymore, and, like, put it on 2 times speed. Like, if you or at least, like, listen to it when you're going for a walk or something like that, even if you're not gonna take notes, because there are nuggets in there that, like, will A, help you with the test, but, like, B, will help you with your future. So, watch those, put it in your calendar and just, like, find a way to watch them. You will thank yourself later, and then you'll have 2 hours of lab, and I know a lot of people, again, with the whole like their thought process on like chiropractic school and like, should we be doing this? Should we not? And like, they're basically just saying we don't need to adjust. And I just want to like let you know, like, again, be open minded. And they're not saying don't adjust. They're just giving you a different way of looking at a problem, which I appreciate because like we've been told our entire chiropractic school train or not train, but like journey of like adjust, adjust here, adjust. And I'm not taking anything away from adjusting. I love adjusting. I'm an MPI rep for a reason. But I am also here to build my tool belt so I can like actually help the person that is in front of me. If adjusting isn't working, then adjusting isn't working. I need something else to help the person. So that's where I know a lot of people get angry with the whole like active rehab portion, but you might find that it might be it might help the issue that you are dealing with right now or someone in the future. So just stay open-minded with that. He is really particular on the way that he does his coaching, but he does that for a reason. He explains the difference between like motor learning and motor control and goes into like external and internal cues, and he'll make this like giant um what would you call it, a T-chart pathway, something like that, where it starts with like BPS, which is biopsychosocial model, which is kind of their big or the DMAC's big thought process on like how they see chiropractic. And that just basically means that like the biology of a person can interplay with the psychology of the person and vice versa. And within that, there is motor learning. But then there's also motor performance. Motor performance is like, let's say you're shooting a basketball and you're in the middle of a game, and then your coach says, like, hey, make sure you take your hand and reach into the basket or something like that. And because you stated hand, that person knows in that moment how to change their form to perform better, but it will only work for that short period of time. Or the example that HEMAC will give is when you're cramming for your finals and you don't actually understand and learn everything, but you pass the test. Motor performance right there. And then there's motor learning where you actually learn and understand through exploring and know how to perform that movement or like know how to understand that test or the subject later on. And so the way that he coaches is based off motor learning, and you'll use external cues, which is basically like just coach something without referring to the person's body part. So like a good example is if you're doing like a hip hinge exercise and you're trying to shoot your like back pockets to the wall, or that's the cue that you give instead of saying like bend at the hips. And I will tell you the amount of times I've tried to coach a hip hinge with people when I was doing personal training and the hoops I'd have to go through with like the stick or just saying like pretend you're closing a car door with your butt or something like that. I wish I knew this because okay, maybe we're coaching this on chiropractic students and we know what's actually working, but I've actually done this with my family and it actually works. So like even though it may be annoying to change the way that you coach and you've been taught your entire life just to refer to a body part, or you might have to think a little bit harder with your cue, there's actually something to it. Because then your internal cues is where you refer to a body part. And you don't want to do that because then that would be motor performance at that point. You can also do what is called an implicit learning strategy, where he'll call it CLA, Bebe, to just go off of Dr. J, but it's called CLA. And basically that means that like you have three different variables. You have an individual, a task, and an environment. You can either change the individual, you can change the task, or you can change the environment. Well, if you're trying to teach someone how to perform an exercise, you can't change the person. Sorry, that is your patient. You can't really change the task because that's what you're trying to get them to do. Like, I guess you could technically change the task if it isn't helping with the goal. But in this instance, with this class, you can't change the task. With the only thing you can change is then the environment. So that is either like maybe adding a band or changing where the kettlebell is. And that's another way that you can change how someone's form is. So it's really interesting to learn about that. And I just say, like, keep that in mind when you are in class. And that's kind of a really big foundation, especially when it comes to his exams and just also teaching in general. And I will say something that I really do appreciate about HEMAC is that he's always trying to make the class better. Not in the sense of making it easier, but like to make you a better clinician. So there's been a lot of talk recently of like him changing his practicals, which he did. I don't know if he's going to keep it this way or not, but what it was before was basically you picked three cards, and then after you drew the three cards, then you get to pick the single exercise that you want to do, and then you just like list out a ton of stuff. Kind of like ortho, except this time it's not just one card, it's like multiple cards. And he's not doing that anymore, or at least he didn't do that with our try. Now he's doing what are called like group practicals. And he's like, I want you to feel the burn. I want it to be hard for you. And I appreciate that. And I know a lot of other people wouldn't agree with me on that, but I appreciate it because I would rather be feeling the burn right now where I don't have an actual patient in front of me saying like, "Help me. Why isn't this working? Why am I in pain?" I would rather not be in the burn during that scenario and be like in the burn where I have a someone who knows more than me teaching me on like, "Hey, this is how we can improve this." So, in the group practical, you basically get a case and you get to look at it beforehand, and then you have to decide what the red flags are and what the yellow flags are. Red flags are basically like if the patient has signs of cancer that like maybe they shouldn't be in our office. Those are red flags. And then yellow flags are basically a sign of like they signs of that like they could be developing chronic disease. So this could be psychological things. This could be like social economical things. This could be the way that they talk to themselves. All of that can fall under yellow flags. And then what you will do is decide what assessments you want to do. So these could be orthos, these could be functional assessments, these could be neuros that you'd want to do to kind of decide how am I going to treat this patient, or like what other insights do I need before I decide to perform a exercise on this person. That is like the group portion. So you all get to work together on that and kind of talk through like what you're going to do, and you all are graded on that portion together. Then the individual portion is basically the same thing as like the first practical, where he had you like pick a card and then like perform the exercise, but except this time it's like based off your conversation. That is the exercise that you're doing. So let's say that we wanted to strengthen the rectus femoris, or like your quad muscle. And then I had said like, "Oh, we should do a Bulgarian split squat." Then my individual portion that I am graded on is how I teach the exercise to the person who he decides is like the person that I get to teach, and then me using an external cue, having them perform it, and then if anything needs to be fixed, fixing that by either using the CLA model or by like giving another external cue to then fix that. And then he'll like ask you a few questions about it. Again, he wants you to feel dumb because he wants you to feel the burn, but it's not, if you perform the exercise right, if your group does well, and you are seeming like you are trying to answer the question as much as possible, or you are getting there some way, like your grade is going to be fine. And the thing that I want you to remember when you're coaching is always say something that you want the person to appreciate. Give them an external cue, perform it, fix it. That's kind of like the order when it comes to performing an exercise. And the reason why he wants you to say appreciate is because everyone's got a lot of stuff going on. And if you had an actual patient in front of them, they're probably thinking about like 5 million other things in their head. But when you tell them, "Hey, appreciate this," they're able to actually focus on what you want them to do. And then when you give them an external cue, don't say a giant paragraph or a giant page or give them a giant story to work through for this cue. And it kind of hit me when HEMAC had said this, where he's like, don't give them rep ranges, or don't give them like a certain amount of reps that they need to do, because all they're going to be focusing on is the amount of reps that they need to do and not the actual exercise they're performing or the cue that you gave them. And when he had said that in class, I was like, okay. But then when I went to the gym the next day or a couple of days later, I had realized for myself, I was like, okay, I need to do like 12 reps, and I'm counting the amount of reps that I'm going. And I remembered that I had given myself a cue of like, whatever, I think I had like Parker University on my shirt, which is like another cue you can give instead of chest up. You can say like, bring the Nike symbol to the wall. And I had remembered that I had given myself that cue, but I started to float forward, and that could be due to like me starting to fatigue, but then once I gave myself the cue again, I came back up, and I remember I was so focused on the amount of reps that I was doing, I kind of forgot about the exercise, and I was like, that's basically what happens to your patients. It's like, it works. Like, that's why you don't need to give someone so many things. It's kind of like the person who's like telling a story at the dinner table and you're just like, can you finish the story? Like, there's so many components. You might be feeling that right now listening to this podcast and me going down like 5 billion different rabbit holes. Like, there's a point in time where we just need to be short and sweet, and that is in this time. So if you can get that external cue to be short and sweet, perfect. You're like on the right track. So that's kind of like what the practicals are formatted as when it comes to PT2. Again, it's okay if you feel the heat. It's okay if you feel the burn, because you would rather feel it now than in clinic. Now for his exams, I'm not going to lie, they're pretty tough. Especially if you didn't have like a personal training background or a coaching background, or you didn't go to R2P. There's a lot of terms that I realize a lot of people aren't used to, like open chain versus closed chain and what that is, and like the BPS model. Even though I didn't understand what that was at the beginning. Like, I had just learned about the BPS model when I first got to Tri 6, but I remember in lab when he drew that out, I drew that out myself and kind of ingrained it in my brain to be like, this is what this is. So then when it came to like answering test questions, I knew I at least got like half the questions right, because I understood what open chain versus closed chain was. I understood what the BPS model was. And then I think there's like some questions about like the different exercises you learn, and then um any of the stuff in like lecture that you learn, especially when it comes to like retroversion versus anteversion with the hips and the shoulder. And you wouldn't know that unless you go and watch the videos, online videos, because I'm pretty sure with the shoulder one, that one was in the online video. If you didn't watch that one, then you wouldn't know it for the test. So watch the video. But the the exams, I will say, based off like how he talks in lecture, you're kind of like, "Ah, this seems easy. Ah, this seems easy." And then you get to the test and you're like, "Wait, hold on." So again, if you are struggling with this class, it's okay that it's not perfect. It's okay that you don't understand everything. You at least trying is like what he wants. And then if you're struggling with like the terms and stuff, again, go to R2P, especially the ones that talk about intra-abdominal pressure, DNS. Mackenzie is another thing where like people tend to really like extension. So like go to that so that you get a better understanding of what he is talking about. I will say, I know in ortho, they give you a lab manual. For this class, you do not have a lab manual, and it makes it 10 times easier if you just sit your butt down and make a lab manual that like says the exercise, the external cue that you like to use that typically works, and then like what what's the tissue of focus, and then the rep range that he wants you to do, because each one will have different things, and that will also help you with your weekly assignments that he makes you do. These won't be every week. Sometimes you'll just have a quiz, but sometimes you'll have an assignment that you'll need to do, and it's just really nice to be like, oh, I already have this organized and ready to go. And that's what I did. And doing that and having my friends help me create that was really helpful. So then when I got to studying for the practical, it was so much easier to have everything organized instead of like trying to go through all the videos and all the stuff. And it's like I'm already brain dead and I don't have the willpower to do all the things. So just keep steady with making your own manual and understand what external cues are. I kind of gave you a glimpse into that already, but when you're in class, because I know a lot of you are probably listening to this on break and you're like, I don't understand this. Make sure you pay attention when he's talking about those external cues. And my last tip that I have is um, even if you're not going to do exercise, and I think I've already talked about this, is even if you're not going to do exercise, you need to know how someone's exercise may be affecting someone's treatment. So there's a topic that I think is either taught in FAP or in PT, or it might be both. And it's this thought process of functional demand versus functional capacity. Basically what that is saying is that when someone goes to the gym, they have a certain amount of capacity that they can handle. This could like you could maybe even plug in the word volume if you're used to like being like, I track my sets times weights and that equals my volume. So that's kind of like your functional capacity. It's like how much someone can handle. Let's say every week I run a mile. So I know I can handle running a mile. But then one week I decide to run 5 miles. And then I get really, really sore the next day. So my functional capacity couldn't reach my functional demand because the demand that I was giving on my body was 5 miles, even though all my body could handle was the 1 mile. Maybe a little bit more because it got adapted to the 1 mile, but whatever. When someone is doing too much for what their body could handle, that could result in injury, that could result in the feelings of overtraining. And I almost like using this term more because we're realizing more and more about the importance of activity and how that helps with healing. And even from my personal training background of seeing people be sitting on the couch all the time, not working out, and then here comes new year, new me, and then I decide to go to the gym and hit it super hard, and then I'm like, I'm dying, I hate this, or I get injured, and then they end up just sitting on the couch again because they're like, well, I tried being active or I tried doing this, but it didn't work. Well, maybe it was because you needed to build up your functional capacity before you decided to give it that much demand. That's why slow and steady, or I think even DMAC calls it slow cooking fitness. That's why you need to slow cook the fitness so that you can actually get to where you want to be. And it just goes back to like making small and steady changes not only helps with like your mindset and like changing lifestyle, but it's also better for your body. So it's like, it's crazy how that kind of stuff works. So you need to understand this so that you can help other people that you're treating, but also like for your own exercise. Maybe you're not into exercise, but like you realize the importance of like lifting weights and being strong so you can be independent when you're 80 years old. You need to understand how this works so that you can apply it to yourself, if that only is your thought process with that. But anyways, I'm gonna get off my soapbox for a second there. All right, next class is OB. This is with oh, I forget her name. I don't remember her name. I'm really sorry. I can see her face, but this class basically is just a 2-hour class in lecture. To You have to be in lecture for this class because she'll make you do these like weekly assignments. And if you're in class, you don't have to do the weekly assignments. And granted, I probably could have like done the weekly assignment, the other option that she gives you where you like have to like find a research paper and like make a video and yada yada yada. But I was like, I'm already here from 8 to 5 anyways for all my other classes, and OB is like smack in the middle from like 1 to 3. Might as well just stay here so I don't have to like do this weekly assignment. So make sure you go to that one so you don't have to do like the weekly assignment that she makes you do, an alternative of like not going. And it's pretty much general stuff. If you've been paying attention in all your other classes where there's like pathologies, then you'll be fine because it's literally everything plus pregnancy. And I will say you get 2 adjusting labs in this class where you learn Webster, which is a certain technique on how to adjust a pregnant patient or just like adjust someone in general. There's also an adjusting lab where you learn how to adjust babies. We don't get actual babies, sadly. You'll get baby dolls that you can like mess around with, which is pretty cool because we've never really been taught how to adjust like babies before. So that was an interesting lab. And for this class, tips wise, I just say like read the lecture slides before the test. Most of the time, she like puts on what she just has on the lecture slides. The only thing that I'd say you'd need to memorize is like knowing the different types of pelvises that are like that people can have, and then like which one is best for birth and which one could be not as good for birth. And then there's like another chart later on for one of the tests that basically says like the baby should be walking by this time. The baby should be eating and being able to talk by itself at this time. So, and by certain months. So just know that. And then just be there to get the assignments done. It's really like that simple. All right. Next class is DiffDi. And this may change because we got a new professor, Dr. Moore. If you've never met Dr. Moore before, I'm telling you, everyone loves Dr. Moore because he is just this like wealth of knowledge that he could like base off all the statistics. Like he could, if I wanted to go win chiropractic or like pathology trivia, I'm bringing Dr. Moore with me because he is just a knowledge bomb when it comes to all of it. I'm pretty sure he just put a textbook in his cereal every morning and just ate the textbook because he somehow verbatim can just like spout off all the things and all the research studies, which is crazy. So if you get a chance to just talk to him or ask him questions, like ask the question is all I'm saying. But the reason why this may change is because he is a new professor to DiffDi, and he's always trying to improve class and lab. I remember at the end of labs, him coming up to us and being like, hey, does this make sense? Hey, do you like this setup? Is this helping? And if you know anything about Dr. Moore, he loves repetition. He will ask you questions over and over and over again. He will just make sure to bring up a topic over and over and over again because he wants you to actually ingrain it in your head and understand it and know it. For the class setup, it's basically a 2-hour in-person lecture. You we'll learn about spine pathology. It gets really, really repetitive. I think you'll start in like the lumbar spine, go to like the cervical spine, and then go to the T spine. And it's like, okay, we've got a lumbar strain. Okay, we've got like a spondy here. Okay, here we go again. And it gets super repetitive, but I loved that because then I didn't have to study because there was only like a few different ones that were like different from the other parts of the spine, which was really nice. Then you'll go into headaches and then you'll go into upper and lower extremity pathologies. I will say this class is kind of tough if they decide to leave it at the spot that it is at, because the class is from 3 to 5. And if you've had lecture from 8 and then stri- you'll have like lecture right after that. What we had was like FAP from like 8 to 9, then business from what was it, 9 to 10, and then PT from 10 to 12, and then OB from 1 to 3, and then diff die from 3 to 5. I was like, my brain was dead. So make sure you get your little like break walks and get some fresh air. I know my friend during lunchtime, she would go to the gym so she could get her body pumping and moving because you get to that last lecture and people were just like heading to the cafe to get all the snacks because they just need a little pick me up power up. So I think the cafe really enjoyed that we had that lecture on Tuesday. But for the most part, he likes to repeat a lot of things. He will typically give you a review day for the test coming up. I think one of the tests we didn't make it through all the content, so he couldn't like give us a review. So know your stuff, but also be like, oh, I might have a review, so it might not be that bad if I don't remember everything. Lab is pretty cool too. You'll have 2 hours of lab. And honestly, this is probably one of my favorite labs, especially if you're like a problem solving type of person and don't let your perfectionism get in the way of you learning. Then this class will be really, really fun. Basically, what happens is you'll like get a case and you take a full history, that whole like FMNOQQPPRSTT and AS that you learned in, I think that was Chiro methods, comes back. I want to see if I remember what they all mean. So like F stands for functional, M is mode of injury or mechanism of injury, N is new or old, O is onset, Q is quantity and quality, P is palliative and provocative, R is referral, S is site, T is treatment, other T is time, and then AS is associated symptoms. Let's go. So you'll have to know that, and then like the questions to ask for that. And then after that, you'll come up with like different diff dies, which are basically possibilities of what this diagnosis could be. Then you go into orthos and neuros and like what other tests you want to do. And then from that, you're like, I think this is what this is. And then your professor will either confirm or deny that what you got was right or wrong. And there will be typically like 3 or 4 different stations, or at least that's what we had for our lab. And you'll like rotate who you have. So like one week I'll have Dr. Moore, the next week I had Dr. Felton, the next week I had Dr. King. So it depends, and it's cool to see their like different insights of how they would treat a certain pathology. So have fun in that lab. It's really fun. The practicals are basically the same setup. So you'll have stations where like you'll get a case, you'll read the case, and you'll be like, okay, what does this tell me? And then you go to the next station, take a full history. So that whole thing that I just like spelt out a couple minutes ago about with the letters, that's what you have to go through. Make sure you hit every single one. And then you have to think of 3 different diff dies that make sense. The third diff die is always the hardest one to come up with because like by the time I take the history and by the time I like read the case, I'm like, I know this is ankylosing spondylitis. But yet I'm like, oh, what other arthritis can I put on here that isn't inflammatory? And I remember being in the practical and being like, what do I put? And I knew it was wrong, but I put RA because I was like, I can't think of another arthritis or another pathology that would go into this, but I know I'm going to get points taken off because like it's inflammatory and ankylosing spondylitis is non-inflammatory, but whatever. Well, it's fine. So coming up with that third differential can be really hard, and honestly, I feel like is the hardest thing of the whole thing. But then after you come up with the diff dies, you need to decide what tests you want to do. So you'll like tell one of the professors like, "Hey, I either want to do inspection, vitals, orthos, neuros." And you have to actually know what the ortho name is. You can't just be like the one that lifts the arm thingy or the one that like lifts the leg. Like that won't cut it. You actually have to know the name for that one. Or you'll like give specific neuros like I want L5 myotomes, stuff like that. And then after that, you'll just like give your final diagnosis. And the best thing that I can say for this is that if it acts like a duck, it quacks like a duck, it's probably a duck. I definitely took that from clinical imaging, so it's fine. But if it seems like a duck, pick the pathology. Even though if the like orthos may seem like it's something else, or like what you learned that ortho should be positive for is something else, it may just be causing pain because like they may just have a systematic disease that like would cause pain there. So if you feel like based off the history, if you feel like based off the case, you're like, it is this, it is probably that. The only tips that I really have for you is that like the first test that he gives you, I don't know if he's going to change this or not, but the first test he literally was like, "Hey, I'm giving you this sheet. It has all the information. Know all the information on this sheet." And he was not kidding. I like it would list off a pathology and then like all the different things he wanted you to know about that pathology. I literally took that, made that in the flashcards and like verbatim just like memorized it. And I remember being on the treadmill and just like flipping through it. And then I took that test and I was like, I'm pretty sure I got a 98 on that test. So make sure you memorize that piece of paper. The next thing is to review your orthos, especially if there are ones that you remember the names are just really hard for you to remember because like you only had one trimester to know all the orthos. So give yourself some grace. You went on break, you forgot about them, so just like review them for a bit. I know for me, the extremities, the names of those, I like mix up a lot of the time, so I had to review those and just know that you need to know those because you can't just say like arm lifty thingy because that won't work. And then the last thing that I wish that I would have done before my friend actually started doing this was she created a document instead of just using the PowerPoint he gives you, because he gives you a ton of information on the PowerPoint. And the things that he repeats, definitely make sure you write down. But we created a document where like it had the pathology and the thing that he repeated or brought up or wanted you to know. We just made like bullet points of that. And then you can easily just read over it like the on your like review day, or you could turn those into flashcards if you wanted to, or when you were getting ready to study for a test and maybe you didn't actually have a review, then you can review that instead, and it makes things so much easier instead of like having to read the like 100-page PowerPoint that you're like, oh, will I get this done? So make sure you do that, and I feel like that will make your life a little bit easier. And I actually forgot I had one more tip, and that is when you get to the entrapment points, make like a tea tree table with like the main points of the different entrapments and like point to it at your arm so that you can like better organize it. That's what really helped me. And then once I made that T chart, then I would like on the whiteboard rewrite out that T chart. And it just made it really helpful to just like blurt it out and then look back at my previously made one and be like, okay, which ones did I forget? What do I need to go over? Stuff like that. All right. I have 3 more classes to go because I realized I forgot one. I'll just talk about it right now. So FSA, you have FSA 2, because last try you had FSA 1, and it's basically the same exact thing as FSA 1. I don't think anything really changed besides the professors. It's the same setup, same thing, same amount of exams. I did hear from some other people that you guys only did like inclinometry for like one thing, and then soft tissue for like one segment. So like let's say if you were just going to do an adjustment in the cervical spine, you do inclinometry for that and then soft tissue for the neck, where now you have to do soft tissue and inclinometry for everything. So just keep that in mind. But it's still that like pass or fail class, super easy. I challenge you to like do the adjustments that are hard, that you don't feel comfortable doing, so that you can like actually get feedback, but also make sure you filter that feedback. And then with the palpations that you aren't comfortable with, do those too. And sometimes I forget, even as a rep, like I forget that there are certain palpations I'm that I'm forgetting to do or that I haven't done in a long time. But then when we circle back around in club and we bring up a palpation, I'm like, I haven't done that in a long time. Then I'll make sure to do that in FSA. So that's kind of like my thought process with FSA too. So just challenge yourself, do the hard thing, keep failing forward. All right, next class, BSc. BSc is one of your philosophy classes with Dr. Hollinsworth. This class is like a 2-hour lecture class, and you can either meet online at the exact time or you can listen to it afterwards. And you'll also have like about 30 minutes. Honestly, I can't really remember because I'd listen to them on 2 times speed, but you'd have a couple of videos that you'd have to watch online for about like 30 minutes. And I'll just say this class, I know for some people like PT and FAP, they like have to be open-minded for it. This class, I had to be open-minded for. And because everyone's going to have that different class that like challenges them and like isn't their favorite. And I'll be completely honest, this one was probably one of them. And it also probably didn't help that it was online too. But I wanted to stay open-minded with this because this is where chiropractic came from. This is everyone's thoughts on chiropractic. And there are probably going to be things in this that we either keep or we either like go away with. And then also, what just popped up in my head is I remember Shemak talking about, it was in one of her classes where people always harp on, in Pilates where they say like bring your belly button to the spine, so that they were trying to prevent like people like arching their back a lot, but then that caused them to do the draw in maneuver and not actually create AIP. And everyone wants to hate on the Pilates instructors that are saying like draw in your spine, and then you get the patient that like comes to you and is like, oh yeah, I like draw my belly button to the spine because that's what I'm told I'm supposed to do. And so then the chiropractor then just hates on the patient, or not the patient, sorry, the Pilates instructor, where it's like, okay, let's stop putting hate and let's educate and be like, okay, this is why they said this, and this is actually what that is doing. So if I don't believe in something, I still need to understand it so I can explain it. And that is my thought process with this class, is like there's different philosophies, there's different things. I may not believe it all, but I need to understand it so that if someone comes up to me and is like, hey, I think this is right and yada yada yada, I'm like, I understand where you're coming from, but this is actually what is happening. So stay open-minded with the class. And I know it's really hard to do that when like you're at the end of the trimester and you're like, I just want it to be done. I've been there. But it's not that bad if you just pay attention and listen to the lectures. From the beginning, it's a bunch of different stuff, like a bunch of different like philosophies. But then it starts to get really repetitive, or she starts talking about like VBIs and stuff like that. So it's stuff that you've already covered, and she'll make you do this project. And I highly recommend doing it sooner rather than later because there are different parts to it. And you also have to make sure that like the, whatchamacallit, the study that you pick lines up with what can answer all those different questions. So make sure you start that sooner than later. And then also make a chart at the beginning. She'll give you one later, but she'll talk about like this chart that has all these different segments to it. And she's like, make this chart. Actually make the chart. It was really helpful for all the exams that I had with her. All right, my last class that I have here is my elective. So in Tri-6, you'll be able to pick an elective. Maybe your elective is different than mine, but I decided to pick multimodal rehab prenatal postpartum. This was with Shemak. So yes, I had a lot of time with Shemak this try. I will have her next try too. So thankfully, I love those seminar style talking because since this is her elective, she gets to go all the different ways with it, which made for great discussions in the class. It was a 2-hour lab, and she'll have like maybe a 10-minute video that you have to watch, and then like a podcast that she's like, hey, you should listen to this. You don't have to, but you should. And I really enjoyed those. I actually interviewed one of the chiropractors that were on one of those interviews, which was really cool. So make sure you watch those. They have a lot of insight into it. The class goes from the beginning of pregnancy to 12 months postpartum and like long term, setting up your patient for long term. And she loves to come at it with a N1 in mind. She says that like sadly a lot of people signed up for this class thinking like it's just going to be a pregnancy class, and it's like so pregnancy is basically like how you would treat every other patient, is like the person in front of you is the person that you're treating, which is basically what N equals 1 means. If you're not in like lingo with like what that means study wise, that just means population equals 1. And so she's just saying that like the person that is in front of you is the person that you're treating. You're not just doing this protocol on a person because the protocol says to do so. You're treating the person based off their symptomatology, based off their goals, stuff like that. There's not a ton of adjusting. We did some adjusting, which was really cool. I love her first rib adjustment. It is really helpful with people, especially because if you like those like T-spine anteriors or supine thoracic adjustments, those are really fun. You will really like her first rib adjustment. But like I said, we'll have like great discussion. She does sort of have some sort of like format when it comes to how she wants to talk about the class or set up the class. But a lot of the times we end up going down like different rabbit holes, which always end up being great conversations. Like one was there was a new paper that came out for 2025 Canadian guidelines for physical activity, sedentary behavior, and sleep throughout the first year of postpartum. And she was like, I don't care what I have planned. This is what we're going to do, which is really cool because I don't feel like a lot of professors would like steer from the plan. And I didn't even know this came out. So it was cool to like actually know that this study came out. And it was basically talking about like how staying active is important. And even if you haven't been active during your pregnancy, like start getting active. And it goes back to that whole like functional demand versus functional capacity, where like, okay, if a mom just gave birth and like I'm not going to tell her go out and walk 5 miles. Like that's not going to be helpful for anyone. But it does mean that like hey, let's get moving. Let's start the ball rolling, because what ends up happening is like most of the studies or most of the guidelines that like people have told pregnant patients is like, okay, for 6 to 8 weeks you do nothing and then go back to physical activity. And then they're like, um so I'm having all these issues and I don't know why. My doctor said I would be fine. And it's because we didn't build up the capacity to reach the demand that you want to go to. So that is kind of like what the study was talking about. And then also just the importance of sleep and getting help from your partner. When they talked specifically about movement, they were saying getting at least 120 minutes a week of moderate to vigorous activity. So that could be like 4 30-minute walks a week or 2 15-minute walks for 4 days. And that's not a lot because literally for the average person requirement is 150 minutes a week. So just keep that in mind. Plus, like, your baby would always love going on a stroller and like getting some sunlight. And sunlight is always great, especially here in Texas, that it's not cold anymore, which is nice. We also had a discussion talking about how moms like how to talk to moms about like C-sections and like unplanned pregnancy, or not unplanned pregnancies, but like unplanned C-sections. And that just stressed the importance of like, I am a guide by the side of my patient. I am not this like dictator or superior that is like, you need to do this. I am here to help my patient reach their goals. And if something happens that deters us from those goals, I am also that safe space that they can come to talk to. And I think that's really important, that something that isn't talked about enough with a lot of Chiro students. So I am happy she creates that space for us to talk about those different things. And the last thing that like came up was we get a bunch of like mamas bringing in their babies and we get to work on moms. We had like a ton of students who had either their wife was pregnant or they had a friend that was pregnant that was like, yeah, you can help me. So I am greatly appreciated for those women that came in and were like, hey, like, yes, I am here to help students learn to get better. So thank you so much to all those moms that helped us students learn and get better. The way that you will have your midterm and final practical is a little bit different in her class. For your midterm, it's basically going to be this group presentation where you're either talking to OBs or my sister's dog just walked in. Hello, Sheba. We get a little guest appearance. Can you guys see her? um so I just lost track because of the dog now. The midterm, sorry. The midterm is a group presentation where you are either talking to OBs or moms, and you're either telling them like, hey, chiropractic care can help with upper back pain or can help with lower back pain and stuff like that. And you're trying to explain to OBs why that's important, or you're explaining to moms like why that's important, which was really cool. And something that we don't get to do a lot, because I know sometimes we do like QEP projects and everyone kind of rolls their eyes at those, and this is not one of those. It's a little bit different. Then your final practical, you basically get a case and then you write a post-treatment email. So I remember writing something like this with my nutrition clients where you're just trying to cover all their goals, trying to like work through and like next steps and stuff like that. And then I would send it off to them. This is basically the same thing. You're telling your client like, hey, this is what we talked about. This is what we're going to do to help that. These are your goals, yada, yada. And then you'll also make an email that will be sent to a colleague to be like, hey, this is a patient that I have. This is what they're presenting with. What do you think? Yada, yada. And then you end the try with like a cool potluck and just take your final exam. So this was really a nice elective to have. It wasn't super intense. It wasn't aggressive or anything, or I didn't have to do a lot of studying outside of this class, like at all. It was probably the most effort I had to put in was in the project and the final practical, which makes sense because it's my midterm and final. And with that, I would say just pay attention in class and have fun. That's my only tip that I have for this class. Like, have fun, enjoy the class if you end up taking the elective. And if you do end up taking the elective, reach out to me on Instagram. I'd love to answer any questions or learn what you learned in class, because I feel like this elective, since she isn't like a cookie cutter elective style format where like we're going to learn this, then this, then this, then this, you're always going to get something different with each elective turnaround that she'll give you. But yeah, this is the first part of Try Six podcast. I know I talked a long time on this one, so thanks for sticking with me. If you listen to this entire podcast, I hope this breakdown helped you and helps you feel more confident when it comes into heading into Try Six, or just gave you a better idea in general. If you have any questions, please let me know on Instagram or you can email me. And stay tuned in 2 weeks for my personal take on Try Six and also answering your guys' questions when it comes to Try Six and also taking part one boards, because I took that, baby. Let's go. With all that being said, I can't wait to babble with you next time. Thank you so much for listening to this episode of Becca Babbles podcast. If you enjoyed this episode, the best thing that you can do is leave a 5-star rating and review on Apple Podcast, Spotify, or any other listening platform of your choosing. If you want to learn more about me, you can do that by following me on Instagram at Becca and Wellness, or by checking out my blog, freebies, offers, and newsletter on my website at beccaandwellness.com. If you want to share the love of the podcast, you can do that by taking a screenshot and sharing it on social media and tagging me and the podcast at Becca and Wellness and using the hashtag Becca Babbles podcast. I hope you have a great rest of your day, and I can't wait to babble with you next time.